Hello, everybody. My name is Buna, and I'll be presenting on Taiwan's healthcare policy. We're going to talk a little bit about Taiwan first. Taiwan is a small country with a population of 23 million located in the eastern part of Asia. It's one of the richest countries in the Asia-Pacific area. The life expectancy of males is about 75 years old and 81 for females. The Taiwanese government adopted a single-payer system in March 1995 called the National Health Insurance System. To the right, there's a picture of the island of Taiwan. Coverage. A true universal Taiwan has a true universal healthcare system. 99% of all citizens are enrolled. Every Taiwanese citizen has a NHIC card, which is used to identify the person, store a brief medical history, and to build a national insurer. Um, the NHI covers all medical services. The NHI system covers most forms of treatment, including surgeries, related expenses such as examinations, laboratory tests, prescription medications, supplies, nursing care, hospital rooms, and certain over-the-counter drugs. It also covers dental, Western medicine, Chinese medicine, and elderly care. Of course, if you're overseas, you're also covered as long as you keep paying the premium. And then up top there, you see what the NHI IC card looks like. Quality. The Taiwan has great accessibility. The NHI has contracted over 90% of private hospitals into the program, including teaching hospitals and tertiary care hospitals. There are very short waiting times. There is generally no waiting list, and patients can normally see any specialist they wish during the normal working hours. Life expectancy has increased from 1995 till today. Um, Great data collection from the national research. The database keeps getting better and better from when it first started till now. And then also patients can go to any hospital or see any doctor. The cost. The cost is very low. The average family household is paying about $50 per month, or the average person is paying about $50 per month. Taiwan's NHI has one of the lowest administrative costs in the world. It's only about 2% of the total annual budget. There's a co-payment if they receive any of the following care: inpatient, dental care, emergency care, or Chinese services. Um, there's a low premium policy at a fixed rate of 4.25% based on their annual salary. Funding into the health insurance is from employees, employers, and government, both national and local. For choice, you have two choices: either enroll in the NHI or refuse it. The NHI is mandatory, and you have to enroll since birth. It's government. It's a government-ran insurer, and then also there's ways you can refuse it if you're unable to pay the premium. But there's also programs that help you pay for it if you're struggling. If you have interruption in jobs, if you're in between jobs, and then also if you just think the premiums are too high, you don't have to pay it either. Here are my references. Thank you very much.